back with our therapist, Emily Diala, Shayna Lewis, and Dr. Pastor Ben Young, answering your relationship questions. All right, let's go to Yvette on the phone lines. Good morning, Yvette. Yvette, can you hear us? All right, so let's move on to Diane.
Oh, I'm Diane.
Hi, Diane. How are you? We'll take you, Diane.
All right. Good. I love you, too. Hey, it's hard for me now to say my problem because of the grief a previous caller had and Brother David. Anyway, I feel my problem is minuscule. My problem is I'm so sad about myself because I've lost so much weight. I can't stand myself.
Have you lost like a lot of weight and have like leftover skin, or is it losing a lot of weight because there's anorexia? What was the reason why you lost all the weight?
I believe so, hon. I don't believe so. I was 130. I've been married 11 years, and now I'm barely 100 pounds. But anyway, that affects my sexual desire because I hate the way my body looks.
Body image issues is, again, one of the many, many things that can influence our desire to have sex. And, you know, I guess I would just want to ask some more questions to see if this sudden weight loss was there like a medical issue that caused you to lose a lot of weight, or have you just not been?
No, I had all the checkups and all the blood work and blah, blah, blah. Yeah. No, there's nothing like that.
So they don't know why you've lost so much weight and you haven't changed your diet?
I think my diet's changed because I don't desire food, really.
Okay, so let's have here. Yeah. So, do you know why you've lost all this weight? It didn't come out of the blue, right?
I'm sorry. Say it again.
Do you know why you lost all the weight? It didn't just come out of the blue.
Well, it's been a period of 11 years, and I go to the grocery store, buy food, and then I bring it home. I'm like, there's nothing here I want to eat.
I mean, some of this could be symptomatic of depression. One of the symptoms of depression is called anhedonia, which literally means a loss of interest in things that you once found pleasurable, like food and sex. You know, and so I would just want to do a
self-punishment.
Yeah, I would want to just do a more thorough evaluation to see if there's, you know, other symptoms that could be going on that suggest depression, and it may be just getting on an antidepressant or working with a therapist could help get those feelings back. But
and I would say, this is a case where really, because you checked out the medical side of it,
right.
to work with the therapist,
the emotional and mental health side, absolutely.
And you start out by saying you feel like your question sounded, or your problem sounded so minuscule. No problem is minuscule if it brings that kind of emotion.
Absolutely.
Right. Everything is
so.
Absolutely.
Yeah. So thank you, Yvette, very much. Oh no, I'm sorry. That was Diane. Thank you. Now Yvette is on the line. Good morning, Yvette. Good morning.
Good morning. How are you, Deborah?
Good. Thank you very much. What was your question?
I have a question. I am a 56-year young lady. I've been single for 9 years, and I am in hopes that you can find me a date.
Oh, wow. You hold on the line, Yvette, and we'll get your information. We might have to have a little dating game action coming up.
Please do.
Yeah, because we had some people in the audience who were like, I'll go out with their sight unseen. But seriously, hold on the line, and then that way we'll get your information and we'll bring you back and do a little dating game. Your greatest opportunity for getting married and finding the one, at least the first one, is usually right out of high school, college atmosphere. You have all the single people there, and so after that, and you get out into the workplace, that diminishes somewhat. And then, of course, when you get older, there are lots of single people out there, but it's a little bit harder. Okay, let's go to Jesse in our studio audience. Hello there, Jesse. Hi.
Thank you for having us this morning on your program. Again, Miss Kathy's call and her comments kind of opened up my question as far as the senior citizens of the United States. So many, as far as widow and widowers, and as far as devoting their life 30, 40 years to someone, and afterwards they deserve to find someone else. And again, I know it's difficult for many as far as their finances or what they may have, that they're careful that no one will take it away. But for me, I feel that we should encourage them to seek companionship and whatever relationship they can come up with no hesitation.
Yeah.
Because we still continue to live.
Well, it's interesting. We live like 2 lifetimes today compared to like 1900, right? And so things happen like that. And you don't, just because that person goes away doesn't mean you stop feeling and stop loving and needing that companionship. And don't studies show that when you're in a relationship, you live longer, you're healthier? Yeah.
We have a psychological need to be connected to other people.
Yes.
We just do. We are healthier. Our well-being is better. We live longer. We're happier. It's just a reality.
I think there needs to be a dating site. There probably is one, like single seniors.
I'm sure it is.
Being part of the senior group in our community, many of them are widowers and all that. And when someone comes up and says, well, that I'm looking for a person, fine. Look for it.
Yeah.
Don't.
Just ask out of curiosity, is one of these young women here one of the ones you found?
No, not me. This is my wife.
Okay, so you were speaking on behalf of your friends in the community. That's it.
Exactly. We had one lady friend that mentioned to us that she was getting married, and my answer to her was, "Why?" And she looked at me and said, "What?" And I said, "You don't have to get married. This is the thing that many of them feel they will lose their benefits."
Right.
And they live that way. But again, there's.
Well, when you're a senior citizen, you just do what you want to do. Is what
that is correct. Thank you. Thank you.
We'll be right back.